What if the reason your blood sugar stays frustratingly high has nothing to do with your willpower, your calorie count, or how many steps you walk each day? What if the real culprit is a type of fat you cannot see, cannot touch, and cannot feel? Fat buried deep inside your abdomen, wrapping itself around your liver, your pancreas, and your intestines like slow-moving insulation. Here is the part that shakes people when they hear it for the first time. You can step on a scale, see a perfectly normal number, look in the mirror and feel reasonably fit, and still carry dangerous quantities of this hidden fat around your internal organs. Scientists have a name for this phenomenon. They call it TOFI, thin outside, fat inside. And research suggests that a significant portion of adults who believe they are metabolically healthy may actually be walking around with this invisible metabolic burden and have no idea. But here is the part I really want you to hold on to. There is one fruit, one that most people already pass by at their local grocery store every single week, that has been examined in peer-reviewed clinical research and shown to influence the reduction of this deep abdominal fat. Not through some vague mechanism, through specific identifiable biological pathways that scientists have measured and documented. Over the next few minutes, I am going to walk you through exactly which fruit this is, what it does at the cellular level to produce these effects, and how to incorporate it into your daily routine in a way that aligns with what the clinical evidence actually supports. We will also go over the mistakes that undermine the potential benefits, mistakes that are surprisingly common. Now, a lot of people assume that insulin resistance is something that creeps up on you slowly over decades. Something genetic, something inevitable, something you manage with medication and accept as part of aging. But that framing does not tell the whole story. The metabolic systems that contribute to insulin resistance are, in many cases, remarkably responsive to specific dietary inputs. And one particular fruit contains a unique combination of bioactive compounds that engage several of these systems simultaneously. My name is Dr. Leana. I am an emergency medicine physician with a deep interest in metabolic health. After spending close to 15 years watching patients arrive in the emergency department, not just from acute injuries, but from the downstream consequences of chronic metabolic dysfunction, I started asking a question that would not leave me alone. Why do some people accumulate visceral fat so aggressively while others with similar lifestyles seem naturally resistant to it? The answer, as I found in the research literature, is not as simple as calories in versus calories out. It is not even primarily about exercise frequency. It comes down to a set of processes happening inside your fat cells and your liver, processes involving fat oxidation, inflammation signaling, and gut-liver communication. A handful of natural compounds have been shown to influence these processes meaningfully. And one specific fruit delivers several of these compounds together in a whole food form your body can begin processing shortly after eating it. In this video, I am going to cover several things in detail. First, what visceral fat actually is and why it behaves so differently from the fat you can see and pinch. Second, the specific fruit that has been studied in randomized controlled trials for its effects on deep abdominal fat, measured not with a bathroom scale, but with precision body composition imaging. Third, the biological mechanisms researchers have identified that help explain why this fruit produces these effects. Fourth, the daily amount and preparation approach that aligns with the evidence. Fifth, practical tips from my own clinical experience to help you get started. And sixth, the common mistakes that can undermine all of these potential benefits. Before we go any further, I have a small request. Many people watch these videos regularly without realizing they are not subscribed. If you find this kind of evidence-based health information useful, subscribing is free and takes just a moment. It helps this channel reach more people who are looking for well-sourced content rather than recycled health trends. Now, let us start with the basics, because most people have a fundamentally incorrect picture of what visceral fat is. When you hear the word body fat, your mind probably goes to the soft layer under the skin, the kind you can pinch around your waist or your hips. That is subcutaneous fat. While having too much of it is not ideal, it is relatively metabolically quiet. It stores energy. it does its job. Visceral fat is an entirely different entity. Imagine your abdominal cavity as a sealed industrial workspace. Inside it sit your most vital organs: your liver, your pancreas, your kidneys, your intestines. Now picture someone gradually filling that workspace with a dense, expanding material that wraps around every piece of equipment, presses against every surface, and infiltrates every gap. That is what visceral fat does. It accumulates in and around your organs, and as it grows, it does not just sit there passively. Visceral fat is biologically active tissue. It continuously releases inflammatory molecules, a class of signaling compounds called adipokines, directly into the portal vein, which is the major blood vessel that feeds straight into your liver. Your liver then receives a constant bombardment of inflammatory signals, and one of the first things it does in response is begin losing its sensitivity to insulin. It stops responding properly to insulin's instructions. This, according to a body of research, is where insulin resistance frequently begins in many people, not in the muscles, not in the pancreas, but in the liver, overwhelmed by the chemical interference radiating from visceral fat. And this is precisely where the avocado enters the conversation. Despite being casually dismissed by some as simply a trendy high-fat fruit, the avocado is, in scientific terms, a remarkably complex food that contains multiple bioactive compounds relevant to exactly this chain of metabolic events. Let me walk you through what the research has found. Researchers at the University of Illinois conducted a landmark randomized controlled trial published in the Journal of Nutrition, in which 105 adults with overweight or obesity were enrolled for 12 weeks. One group consumed one fresh Hass avocado daily as part of a provided meal. The control group consumed an isocaloric meal, meaning the same number of calories, but without avocado. Body composition was assessed using DEXA imaging, which stands for Dual Energy X-ray Absorptiometry, considered one of the gold standards for measuring where fat is distributed in the body. The results were notable. Among women in the avocado group, there was a statistically significant reduction in visceral adiposity and in the ratio of visceral to subcutaneous fat compared to the control group. Importantly, total calorie intake was matched between groups, meaning this change in fat distribution was not simply a result of eating less. I should note, and this is important for accuracy, the study did not find the same effect in male participants, and it did not find significant improvements in insulin sensitivity markers like HOMA-IR. So the evidence is promising but specific, and more research is clearly needed. Now, why might avocado produce this effect? Let me describe 4 biological mechanisms that researchers have identified, each supported by published data. The first mechanism involves oleic acid and a nuclear receptor called PPAR-alpha. Avocados are approximately 71% monounsaturated fat, with oleic acid as the dominant fatty acid. Oleic acid has the ability to bind to and activate a receptor inside your cells called PPAR-alpha, peroxisome proliferator activated receptor alpha. Think of PPAR-alpha as a metabolic switch. When it is turned on, your cells shift their priority toward burning stored fat as fuel, specifically the triglycerides locked inside fat deposits, including visceral fat. While many dietary fats interact weakly with this receptor, oleic acid from whole food sources like avocado appears to activate it more consistently. This is one pathway through which avocado consumption may encourage the body to mobilize stored fat. The second mechanism involves soluble fiber and the gut-liver axis. One medium avocado contains roughly 10 to 14 grams of total fiber, with a meaningful portion being soluble fiber, including pectin. Here is why this matters for metabolic health. Soluble fiber is fermented by beneficial bacteria in your gut, producing short-chain fatty acids, particularly butyrate and propionate. These compounds travel to the liver through that same portal vein we discussed earlier. But unlike the inflammatory signals coming from visceral fat, these short-chain fatty acids deliver anti-inflammatory messages that may help resensitize liver cells to insulin. They essentially help quiet the metabolic noise so the liver can respond to insulin more effectively. The gut microbiome study associated with the University of Illinois trial found that daily avocado consumers showed significantly increased populations of beneficial bacteria, including Faecalibacterium prausnitzii, one of the most prolific butyrate-producing species in the human gut, as well as members of the Lactospiraceae family. These bacterial groups are associated with improved intestinal barrier function, lower systemic inflammation, and better blood sugar regulation. The third mechanism centers on a compound called avocatin B, which is found in virtually no other commonly consumed food. A research team at the University of Guelph in Canada, led by Professor Paul Spagnuolo, discovered that avocatin B can inhibit a process called incomplete fatty acid oxidation in dysfunctional metabolic cells. When fatty acid oxidation does not complete properly, toxic byproducts, including ceramides and acylcarnitines, accumulate inside muscle cells. These byproducts interfere with insulin receptor signaling at the cellular level, essentially jamming the communication that tells cells to take up glucose. By reducing the accumulation of these toxic intermediates, avocatin B may help clear that interference. In their studies, treated cells demonstrated measurably improved glucose uptake. I want to be transparent here. Much of this avocatin B research has been conducted in cell cultures and animal models. Professor Spagnuolo himself has noted that eating whole avocados may not deliver a consistent therapeutic dose of avocatin B, since its concentration varies between individual fruits. Clinical trials in humans, specifically for avocatin B's metabolic effects, are still ongoing, so while the mechanism is genuinely exciting, it is important to treat this as emerging science, not settled fact. The fourth mechanism involves lutein and inflammation. Avocados are one of the richest sources of lutein among all fruits. While lutein is most commonly marketed for eye health, it also functions as an inhibitor of a transcription factor called NF-κB, which is sometimes described as a master switch for inflammation. NF-κB controls the production of inflammatory molecules including TNF-alpha and interleukin-6, both of which have been implicated in perpetuating insulin resistance in fat tissue. When lutein suppresses their production, it may help slow the inflammatory cascade that contributes to ongoing visceral fat accumulation. Some dietary intervention studies have documented measurable reductions in fasting inflammatory markers with consistent consumption of lutein-rich foods over time. So to summarize the research picture, avocado contains multiple bioactive compounds that each address a different piece of the metabolic puzzle. Oleic acid activates fat-burning pathways through PPAR-alpha. Soluble fiber feeds beneficial gut bacteria that produce anti-inflammatory short-chain fatty acids. Avocatin B may reduce toxic metabolic byproducts that impair insulin signaling. And lutein helps suppress the inflammatory cascade driven by NF-κB. Individually, each mechanism is interesting. Together, in a single whole food, they represent a compelling case for why avocado has shown the effects it has in clinical research. Now let me share the practical approach I discuss with my own patients when they want to incorporate avocado into their daily routine based on what the evidence supports. First, aim for one whole medium avocado per day, roughly 200 grams. Split it across 2 meals, half with your first meal of the day, half with your largest meal. The clinical trials that showed meaningful results used this approximate dose. A few slices here and there will not deliver the same fiber load, the same oleic acid quantity, or the same range of bioactive compounds. Second, squeeze fresh lime or lemon juice over every serving. Citric acid has been shown to help preserve lutein during digestion by maintaining a favorable pH environment that reduces oxidation. It also slows the browning of cut avocado flesh. 1 full lime per half avocado is perfectly reasonable. Third, drizzle 1 teaspoon of extra virgin olive oil over your avocado. Quality olive oil contains oleocanthal, a compound that also inhibits NF-κB through a pathway that complements lutein's mechanism. Pairing olive oil with avocado creates a combined anti-inflammatory effect alongside their shared ability to engage PPAR-alpha. This is not just a flavor combination, it has documented mechanistic overlap. Fourth, eat your avocado alongside fiber-rich companions. At least 1 cup of legumes, cooked leafy greens, or cruciferous vegetables at the same meal. The gut microbiome shifts that produce butyrate require both substrate and an established microbial community to ferment it. Feeding diverse fiber sources alongside avocado helps accelerate the growth of butyrate-producing bacterial populations. Fifth, know that frozen avocado is a legitimate option. High-quality frozen avocado retains its oleic acid, lutein, fiber, and other relevant compounds. Thaw at room temperature for about 15 minutes and eat it promptly. If fresh avocados are too expensive or unavailable where you live, frozen is not a downgrade. It is nutritionally comparable for the purposes we are discussing. Sixth, pair your avocado with foods containing fat-soluble nutrients. Lutein is fat-soluble, meaning it requires dietary fat for intestinal absorption. The avocado itself provides that fat, making it somewhat self-sufficient in this regard. But you can further optimize lutein absorption by including other fat-soluble nutrient sources at the same meal. A portion of cooked salmon, a couple of whole eggs, or a small handful of walnuts. Seventh, beginning around day 4, consider adding half a grapefruit to your morning routine. Grapefruit contains naringin, a flavonoid with its own evidence for activating PPAR-alpha and potentially reducing hepatic fat accumulation. If you have no medication interactions, and this is critical, grapefruit can create a second PPAR-alpha activation event earlier in your day. However, and I must emphasize this, grapefruit interacts with the metabolism of numerous prescription medications, sometimes dangerously. Check with your doctor or pharmacist before adding grapefruit if you take any medications whatsoever. Now, from my clinical experience, here are 4 practical pearls I share with patients. The first pearl is to time your avocado around your highest carbohydrate meal. The soluble fiber and oleic acid in avocado slow gastric emptying and can blunt the blood sugar spike that follows carbohydrate-rich foods. If breakfast is your carb-heavy meal, eat your avocado then. If dinner is larger, reserve the second half for the evening. This strategic timing, repeated daily, may contribute to meaningful improvements in postprandial glucose response over time. The second pearl is about storage. Do not refrigerate whole, unripe avocados. Cold temperatures halt the enzymatic ripening process that converts precursor compounds into their most bioavailable active forms. Let them ripen at room temperature, and once ripe, eat them within a day or 2. If you need to store a cut half, press plastic wrap firmly against the exposed flesh, not loosely over the container, to minimize the oxygen contact that degrades lutein. The third pearl involves the dark green flesh directly under the skin. Most people scoop avocado cleanly from the rind and eat only the pale interior. But published research on avocado pigments has confirmed that the darker green tissue immediately beneath the skin contains significantly higher concentrations of carotenoids, including lutein, compared to the paler flesh deeper inside. Take a few extra seconds to scrape that layer with your spoon before discarding the rind. It is, gram for gram, the most nutrient-dense part of the fruit. The fourth pearl is about managing your expectations and choosing the right metrics. Gut microbiome composition can begin shifting within the first few days of consistent daily avocado intake. Changes in fasting metabolic markers may take several weeks to become apparent, and visible changes in visceral fat distribution, based on the clinical trial data, appear in the range of 6 to 12 weeks of consistent daily consumption. Your bathroom scale is not the right tool for measuring this kind of progress. It weighs everything at once: water, glycogen, lean tissue, all of it. And none of those numbers specifically reflect visceral fat. Instead, track your waist circumference at the navel level. Notice how your clothing fits across the midsection. Pay attention to how stable your energy levels are between meals. These are the early signals that your metabolism is responding. Now, let me walk you through the 4 mistakes that can undermine everything we have discussed. The first mistake is underdosing. Patients tell me they add 2 thin slices of avocado to a salad a few times a week and wonder why nothing is changing. The clinical research was built on 1 full avocado daily. A smear of guacamole on a chip or a few decorative cubes in a grain bowl does not deliver the full complement of oleic acid, fiber, lutein, and other bioactive compounds needed to engage the mechanisms we discussed. You need the complete dose, and you need it consistently. The second mistake is relying on a bathroom scale during the early weeks. Visceral fat reduction will not show up on a standard home scale in the first week or 2. As hepatic fat metabolism begins to shift, lean tissue hydration can increase and glycogen stores can fluctuate. Your scale weight might actually go up slightly even as visceral fat volume decreases. This is a well-documented phenomenon sometimes referred to as body recomposition. It is a sign of progress that looks like regression if you are only watching a number on the scale. Use a flexible tape measure at your navel, not a scale, during the first month. The third mistake is pairing avocado with sugary ingredients. Avocado in a sweetened smoothie, avocado toast drizzled with honey, avocado mixed into flavored yogurt. Every gram of added sugar in that combination triggers an insulin spike that can partially counteract the very insulin-sensitizing effects you are trying to support. You cannot press the gas and the brake at the same time and expect to move forward. Keep your avocado preparations savory: lime juice, sea salt, extra virgin olive oil, freshly cracked pepper, and fiber-rich whole foods. The fourth mistake is inconsistency during the critical first 2 weeks. The gut microbiome shift, the growth of Faecalibacterium prausnitzii and other butyrate-producing populations, requires consistent daily input to establish stable colonies. Eating avocado for 4 days, skipping 3, then picking it back up sends intermittent signals to your gut microbiome rather than building structural change. Think of it like the difference between visiting a city a few times a year versus actually moving there. One builds passing familiarity, the other builds lasting infrastructure. The first 14 days are when you are laying biological groundwork. After that foundation is set, the occasional missed day has far less impact. I want to close with something I believe strongly. Accumulating visceral fat and developing insulin resistance are not inevitable features of aging. The medical system sometimes communicates, intentionally or not, that these conditions are permanent, progressive, and manageable only through lifelong pharmaceutical intervention. For some people, medication is absolutely necessary and valuable, and nothing I say here should be taken as a substitute for your doctor's guidance. Please always work with your healthcare provider when making decisions about your health. But the research does tell us something encouraging. The metabolic pathways that contribute to visceral fat accumulation and insulin resistance are not locked shut permanently. The patients I have seen make the most meaningful progress in their metabolic health are not people with unusual genetics or superhuman discipline. They are people who consistently made specific, small, evidence-informed choices that gave their cells the biological inputs needed to function more effectively. Every mechanism I described today, PPAR alpha activation, gut microbiome support, NFKB suppression, the potential of avocatin B to address mitochondrial dysfunction, these are systems that exist in your body right now. They are not relics of youth that you have irreversibly lost. They are pathways that respond to what you feed them. You cannot activate these systems with motivation alone, but you can support them with a fruit available at virtually every grocery store on the planet, starting with your next meal. Disclaimer: this video is for educational and informational purposes only. It is not medical advice and should not replace the guidance of a qualified healthcare professional. Always consult your doctor before making significant changes to your diet, especially if you have existing health conditions or take prescription medications. If this information was valuable to you, please consider subscribing and giving this video a like. It genuinely helps this channel reach people who are searching for well-sourced, evidence-based health information. And if you know someone who has been told that their blood sugar or their waistline is simply a consequence of aging, share this video with them. They deserve access to this research. I will see you in the next one. Dr. Leana, signing off.